Hello, everybody.
Hi, everyone. Before we get started, we just wanted to thank Sunways for lunch today. We have Ellie in the back. She's going to come and speak.
Thank you, Ellie.
We have Dr. Gonzalez presenting after that. And then next week on Tuesday, we have the Van Wezel here. They're doing a dance class. And Thursday, Catherine is back and she's going to be singing show tunes for the members. So here's Ellie from Sunways. I'll pass on the mic so she can share a bit about her business.
Hi, guys. I'm Ellie with Sunways. If we haven't met before, I work closely.
We haven't met before.
No,
No.
we don't know each other at
No.
all. Yes, we work very closely together as well. But my husband Mark and I own and operate Sunways. We're a free service for seniors and their family members to understand different care options. So what options are available in the home, what options are available outside of the home for emergency planning and plan Bs, like independent living, assisted living, memory care, et cetera. My card and information is here. If you ever wanted to talk about just unique situations and what options might be available, I'm free to do that and a free service for that. And that's it.
Thank you, Ellie.
And I'll let you take it away, Dr. J.
Thank you. Pretty good. Now you're the boss, or? Okay, so first of all, I had to recognize Susan. Susan, wherever you are, and Craig, we miss you very much. Okay, so today I want to go to our journal club. This is the volume of April of 2025. And then I want to do something different. Medscape, you'd be surprised. There was a small news about Parkinson's and living close to golf course. So there's a news. It's a small group, but we talked before about pesticides, so it makes sense. It depends how they treat the golf course. I actually living close to the golf course. So basically that's what's in the news, and I was looking the study, and then as well, and then you'll see some news about mushrooms. So there is some mushrooms that look in the University of Southern California. It sounds that improving cognition in Parkinson's. So it's a lot of excitement in Parkinson's. So again, know that you have to sell your house, right? You're on the golf course, so give up with the golf, but we'll see. Okay, so I get some people sending some pictures. It's one of mine, but again, I receive grateful. You get any sunset or sunrise, please send them my way. Now the day after tomorrow, I go to Venice, so Venice, Italy, and Florencia. So I will try to do some picture, but it seems it's going to raining. So io parla italiano, ciao bambino. Oh, molto bene. Oh, molto bene. You have to teach me. So buongiorno, buonasera. Okay, grazie. And belladonna there. Okay. Okay, so we're looking for atypical Parkinson's again. There's a study about some neurophysiology about people with a pure motor dysfunction and how that work. And again, we have always questions about what happened with the peripheral nervous system versus the central nervous system. So some people with a typical Parkinson's having like autonomic dysfunction start with the peripheral nervous system with orthostatic hypotension, and then they can evolve with other symptoms of Parkinson's. So that's what this article is about. So in this article about deep brain stimulation, so we know DBS or deep brain stimulation is not for every single patient with Parkinson's or essential tremor, but always we know there will be an issue getting the control of the motor symptoms, but then there's an issue with the cognition or verbal fluency. That's very common to get tremors and better control with DBS, but then the fluency, the verbal, get a little altered. So now we have new uncommons, especially with Medtronic, And we get the physiopathology actually getting the brain waves, and we know the beta activity in the brain is one of the frequency that we're looking for DBS, but now they are looking for a different, slower stimulation, the theta and gamma. So we talk about the hertz, the stimulation of the waves in the brain. So that type of frequency that seems to be improving the verbal fluency in Parkinson's. If you have somebody with DBS, so it's in the future. It's not happening now. We just working with beta activity, but there's something there. Okay. So this is what the study showed, that high frequency, basically the beta activity DBS, is what we use for people with Parkinson's to control tremors. Again, when the works very nice, and the reason for me to be a movement disorder specialist is DBS. I love and always have a couple of new cases this week. I always have an extra clinics or because people get tears of happiness when having significant tremors. And we do the DBS and the stalled tremors it's a beautiful thing. So basically, they were looking about the different frequencies, and basically, they're looking about 12 patients that complete the study and looking for the different frequencies of stimulation. We see that already, so the moon. So the conclusion is you do a combined theta gamma stimulation can improve the verbal fluency. The verbal fluency in Parkinson's sometimes is decreased because DBS. And then we know that when trying to improve the tremors, then people get stuck, having difficulty with verbal fluency. And I see a lot of people having difficulty with stuttering or verbal fluency in Parkinson's. So it's something there. So for somebody, we have like 4 or 5 people with suffering from Parkinson's and very bad stuttering. So this is something that could be a little light in the end of the tunnel for them. Okay, going to another article in this journal, we're looking for the bilateral focus ultrasound. That's the other alternative for people looking for DBS, or many people use the high frequency ultrasound for control of tremors. So in previous lecture, we talked on a study in Denmark that we talk when you have the focus ultrasound, you have some issues with gait or issue with the speech. So they said actually want to compare hand-to-hand DBS with high-frequency ultrasound. And the conclusion is that it's the background, they look at the MRI focus ultrasound versus deep brain stimulation and looking for possible side effects. So this is the results. So the tremors control are very good. And actually that's what we want. This is the Mediterranean. I'm looking forward for that. The Mediterranean, that's in Spain. So basically in the conclusion, we go and see that how they work, they work very nicely for control tremors. The difference between the one or the other, remember, the high frequency ultrasound is an ablation. You need to redo your hair. They have to take your hair totally off to send you ablation in the magnet, in the MRI. And then it's not like you get in and out for just a couple of seconds. It's almost the whole day back and forth. And then if they do a good job and place where it is good, but it's ablation, it's irreversible. And they do, it's a little off, you have issue with the speech or issue with gait, unfortunately, can be permanent. Deep brain stimulation is surgery, it's more invasive in one way, but it could be reversible in the sense some people can have infection or complication, they can take it away and that's it. So they are talking more and more about how deep brain stimulation could be neuroprotective. I see a lot of people with DBS not progressing as fast as people with no DBS. And in a previous lecture by Dr. Kenneth Vives, Dr. Kenneth Vives is a neurosurgeon that I work with in this area to do deep brain stimulation. He had a lecture with us probably about 1 year ago, and he mentioned about this and the studies. Okay. Now we go to a different topics. We always look for the cure or different mechanism how Parkinson's um, produce symptoms. So they're doing the studies in the inflammation. So they're looking as well, again, Parkinson's like an infection. So this medication, the montelukast, is a medication that we use in people with asthma or inflammatory process in the lungs. But it seems they did a trial in people with Parkinson's to try to decrease the inflammation. So this is the background and how many people were studied. As again, it's a very small study, only 15 people. But the conclusion is that this medication cross the blood-brain barrier and very low levels and seems to be well tolerated and is safe in people with Parkinson's disease. So it seems that they can improve the neuroinflammatory process in those patients, and it seems to be some promising. Again, it's research, but again, the beauty of this is we want to look not only go to carbidopa pathways, we talked before alpha-synuclein, but looking for an inflammatory process in the brain and other ways to improve symptoms of Parkinson's. We talk later on with the mushrooms. So we're talking, actually, that was sent to my colleagues. Now let's look at this, the news. So they said residential proximity to golf courses linked to Parkinson's disease. That was in the news this week. So we'll see. Again, we know Antas should to sell your house, to give up your golf, but it depends how you have to speak with the people that do the, if they play some fertilizers or anything like chemicals in that grass. So that's something I have to, again, it was a small study, but it was in the news. So this was the news, was in Medscape. Parkinson's disease is a risk linking on proximity to golf courses. So that was in May 12th, just 5 days, 3 days or 4 days ago. So this is a population-based case control study that was in Rochester, and they found, Rochester, we had their real Mayo Clinic, Minnesota. They have a very nice health service there. So basically, this is in the Journal of the American Medical Association. So something is serious. It's not like it was just an internet. So we read all this news. So this is like a flash of news I want to show you now. That's instead of give you just the journal, because the journal we're talking about our movement disorders, which is important, but I like to go from the what is hot or what's happening in Parkinson's. So there's another thing. We talk about the golf now about the food. So you take a half intake of ultra processed foods can be linked as well with Parkinson's. So remember, you are what you eat, right? So if you eat too much unprocessed food, very ultra processed, you are ultra processed person. So remember all the chemicals, all the things that the more natural you eat, the better. We call. So this is something that. So what's the takeaway message? High intake of ultra processed foods may increase the risk of early Parkinson's disease. So a diet rich in fruits, vegetables may help to reduce the risk. People ask, what's my diet? So we always said Mediterranean diet. I went to the Mediterranean. So I want to enjoy the Mediterranean diet in Italy. So thank you for that. So basically we promote that. Vegetables, fruits, fish, try to avoid red meat, try to avoid processed food. That's very thing, body and our cognition and nutrition. Now, there's another news about how much the Parkinson's have been increasing. So by 2050, will be about 25.2 million people with Parkinson's. So this is a lot. So that's been like 112% increase from 2021. So you see how this is increasing. I don't know, it's because you're playing too much golf. I don't know. That's the only reason here. But so what's the takeaway? So the prevalence of how many people suffer from Parkinson's is increasing by almost double in 2050. So in 2025, we're talking 25 years, doubling the amount of people having Parkinson's. So you have to look how you eat. You go to a golf course, be sure that how they take care of that grass, fertilizers. Unfortunately, as well, we are in the past here in Florida, there was a lot of crops and they're using fertilizer. We talk about contamination. The quality of the quality of the air is very important. Okay, hearing loss. I don't know how that link, but it's another thing is the news. Hearing loss associated with Parkinson. Basically, they are associated with Parkinson for most everything, but that's in the news. So I don't know how it's going to be the cause and effect, but they said that because there's the notice, I don't know if it's because the age, but I don't know how to go the cause and effect of this, but consider auditory assessment in Parkinson's disease management for early prevention. Again, how the cause effect of this, I have to a little more in depth, but again, that's in the news. Heavy drinking. So that can definitely damage the brain. Especially we talk about Alzheimer's cognition. So basically, drinking is not good for your brain. And heavy consumption of alcohol is associated with increased brain lesions. Especially, what happens with alcohol, you can decrease the thiamine, the folic acid, and you are at risk of the low Wernicke-Korsakoff encephalopathy or dementia. There's alcohol-associated dementia. There's alcohol-associated neuropathy, and it's because they can produce malnutrition, can decrease heavily thiamine, folic acid, and B12. So I think here, recently somebody come and talk about stem cells or gene therapy. So there have been since I was in my first, second year of medicine many years ago. I want to say how many, but this is a little difficult to go to. A stem cell is like mother cells, like cells that can differentiate to different lines of cells. So we're looking for the ones that can produce dopamine in your brain, and they seem they're getting better and better. So they have two early stage clinical trials that highlight the potential use of sense finally for this. But again, we talked in the past in California, there was a lady, but they tell you about the different studies. So the takeaway for this is stem cell therapy may be offered as a new avenue for Parkinson's treatment. That's a very broad statement. I don't know where, I don't know, tell you when, what centers, but again in California, but that's in the news. That's it's in Mainscape. Now we look about the sleep. So before we are hearing loss, we talk about drinking, we talk about food, but now we'll talk about sleep. So early CPAP use may decrease the risk for Parkinson's disease. Now again, talk hearing, but I say, Dr. Gonzalez, now you tell me hearing, you tell me about the CPAP, you tell me about the food, everything is producing Parkinson's, but again, it's a combination. Remember, the gene, the environment, and the host. So we are the host, and our genes will be proposed, how you're exposed to toxins, or the lack of oxygen, or too much alcohol. So what's the takeaway? So we have now we have a new medication. We're talking about weight and the result. We're talking about sleep apnea. So there's a now new medication, one similar to, we're talking in 1 second about the GLP-1 medications, the glucagon-like peptide that Ozempic and Mounjaro, and there's approved one medication for sleep apnea to do an injection every week. So, but here they said the early use the CPAP, if somebody having a sleep disorder, it's better to use it. And this is new medication. Somebody was asking me about this. So the tabapadone improves motor function in early Parkinson's disease. So it's a new uncommon medication in Parkinson's. So the tabapadone it sounds like Tiva, but it's tabapadone, improve the motor function in Parkinson's disease. So far is producing only very few side effects. So far is well tolerated, and we'll see when it's launched. We have to look at the mechanism, but it's another medication. So we're very excited when we hear new medications. Now, in the last 6 months, we have been beside the Crexon, besides we have a couple of pumps for apomorphine. There is a pump for carbidopa, levodopa subcutaneously. So there's a lot of research in Parkinson's for new medications. Now we always talk about telemedicine in Parkinson's. On the COVID, it was about telemedicine, but I never hear about tele-rehab, like getting physical therapy by TV, right? So you say, okay, you're just watching it. Back in the day, we do some, you seen these ladies dancing, and we do dancing in the, from the TV. They can do tele-rehab as well. So this seems to be working, and tele-neuro rehabilitations offer a viable alternative, especially to in-person care for patients with Parkinson's disease. So that is something similar we're doing already here, right? We do the Zoom. We have the Parkinson's place here, and the therapists come and do the group and the dancing, and people can enjoy that at home as well. But tele-rehabilitation, we talk on physical, occupational, and speech therapy. Okay, let's talk about this. This was a very hot topic, the GLP-1. So the glucagon, like peptide-1, you know about the Ozempic, Mounjaro, you know, people using this for decreased weight and have been very effective for many people. In the beginning was like, we talking about their medication used to be very effective, but now some people get a little disappointed with that medication. But in Parkinson's, the first study for this seems to be not producing improvement in Parkinson's. But we'll see more studies. Initially, we're very excited about this, but for sure, as well, they have studies about in Alzheimer's, but so far this is an excellent medication to decrease weight. So usually, this is not examined in Lewy body dementia. Lewy body dementia, when we talk about multisystem atrophy, most of the time we don't have any news. So we seem to have good news in Lewy body dementia. So there's a trial going on. It's called the CHIMER trial that is offering a hope for people, the treatment for Lewy body dementia. So we're very excited about that. So we're happy with this one. So I just tell you the news that we have some excitement. It's like people ask me about multisystem atrophy, or somebody asked me about essential tremor. Most of the time we're using the same medication for 100 years ago. So the same thing that we're doing for another misfold protein in Alzheimer's. Now I always promote that now because we had the memory clinic. We're doing the PET scan, and we have 2 medications for treatment for Alzheimer's. Hopefully we can say the same for Parkinson's. So now there will be a blood test tracking for Alzheimer's. It will be soon there. So hopefully we can do the same for Parkinson's. In Parkinson's, we are in baby stage, but we're going behind the model that we have for Alzheimer's. So now we have almost 100 people in treatment with Alzheimer's in our clinic. We have Dr. Concha, Dr. Rota, myself, and 2 nurse practitioners, and we have infusions for Kisunla and Leqembi. So hopefully in the future we can say the same for Parkinson's. So Parkinson's is still the model. There is we present previously in the New England Journal of Medicine looking for monoclonal antibodies against alpha-synuclein. So what we're using now is infusing monoclonal antibodies against the beta amyloid, which is the misfold protein that produces Alzheimer's. So hopefully in the future we can say the same for Parkinson's. Okay, so this is the news about the mushroom. Actually, it was my colleague, Dr. Manuel Gordillo. Manuel Gordillo says our infectious disease. He's the infectious disease that diagnosed the first case of COVID in Florida. And he's very proud to be Peruvian. It's like the new Pope is Peruvian American or American Peruvian. And the new Pope is American Peruvian, but he's a Peruvian American. So we're very proud of him as well. So he sent me this article, and he said, what do you think about this? So I was reading, and I present to you. It's as well in the news. And this is a study in the University of South California. So how magic mushrooms, we're talking about this mushroom, not the other mushrooms that back in the day people were using to get high, right? We're talking some other mushrooms. So this seems to be improving. This is University of California, San Francisco, actually. So this is the substance, is the psilocybin. It's a natural compound found in some mushrooms. So that's the chemical that is found to be raising the examine the possibility to improve the brain repair by itself. We talk about restoration of the brain. So what is the good news is about the mood, but not only the mood, but as well some motor effects in Parkinson's. So they are trying to test patients with this, yes, in research. So we'll see what's going on. And so they so far doing a 10 milligram dose. So they follow after 2 weeks, and then they increase the dose to 25 milligrams, and then they evaluate the mood and the motor function. So they don't know exactly that works. They're thinking that this chemical can relieve from multiple symptoms in Parkinson's disease, reducing the inflammation. So we're talking about inflammation today. Montelukast, we're talking about this mushroom, and probably increase the regrowth, reconnection in our neurons. So that's similar we try to do with the stem cells. So sometimes you can play some virus, upload the genes to produce the dopamine. This is working more in the inflammation and restoration of the brain and these misfold proteins pathologies. Okay, that was not bad today. Well, thank you for this here. So I want to open for questions, and today was more the news. It was just a little excited to go to Italy, but a little sad to see Susan leaving. So open for questions. First of all, I want to see somebody shares any experience. Is somebody here in Craigson or any new oncomings or something? Just something to share with the group. Anybody? Yes, sir.
Golf course proximity association with parking. What was the theory for that?
Because so for the people in the Zoom, the question is actually your voice is very good. I'm very impressed. You're speaking loud. I can hear from here. So the theory is because in the grass you use pesticides to keep it good. So it depends what the chemicals they use that to keep that looking good. So is that for the theory? We have to look a little more in that, but they sound like that. That's the exposure. It's like you want in this they place some fertilizers or to keep the grass good, or take again pesticides. That's the theory behind that. Now we know about the pesticides. We talk the paraquat. We talk about our with all the citrus or the orange, people that use that or people have been exposed to orange toxins have been blaming to the Parkinson's. So that's the theory behind that. And even some people said about the dairy. So we're talking pesticides, how you get pesticides to you in your body. So you have milk, and the cows that produce that milk have been fed with grass that have pesticides, then you get the pesticide to your body. That's some theories that behind that. So, yes, sir. I'm sorry. Okay, so yeah, so I don't want to disrupt your golf, but yes, but again, that's a problem. Yes, so I hope it when it's not a good thing to talk in Florida, right? In the golf. But yes, so, yes.
Used all the natural chemicals, take the fat, all that. Maybe I wonder how much or less effective that would be. And maybe that would be the trend. People would start that they're still,
So for the question, actually, she doing a statement we agree. So basically, instead use pesticides or fertilizers that are no natural, those chemicals. Instead doing more natural, then you can probably prevent this to happen. So yeah, I don't think it's the only reason again. So for the most part, we talk about idiopathic, but the pesticides in that would be a topic here. But I have to tell you what's in the news, especially for us heated, because we living close to the golf course. We gone to the golf course. Many people just live to go to the golf course, right? So I don't want to disrupt. You already have Parkinson's, so I don't know how it will impact you more to have or use in golf. But again, it's the news. So even though I was surprised. I'm part of the Latin American Medical Association. One of my colleagues sent that in that chat. So I was looking at that and I was looking that and looking and then I go down in the news as well. So I look in the Medscape and then we'll see. They had to definitely look more big studies. We just a report actually was in Rochester, Minnesota. So it's something very serious right now. But again, we have to look the evidence. How was always when you hear something like this, you have to see the sample, how many people they discovered with that, follow again what they designed of the study. So, but it's a little sad news for us, but what we can do. I don't want to ask you to don't play golf, but this okay. Anybody else? We're very quiet today.
I have one.
I know it's sad. Sorry. Somebody want to talk in the Zoom?
Yeah, I have a question. When will psilocybin be available commercially or by prescription?
I don't know. Thank you for the question, but that I don't know. So we'll see. Any other questions? Yes, sir. That's the first thing she's asked me about the new medication we talk. Again, this is the news, the break news. So I don't have more information for that. Yes. I just give a little of it like a Netflix oncoming. So this to be continued season 1. So just use the trailer. So I just give you the trailer. When come more information, again, is research. This remember when we talk about research, many people ask me one specific topic. I said, let's see. Because this is something and it's in the news. That means that's probably close to come. So we'll see. No questions? Okay. Okay, everybody's quiet. I think we're a little sad to be seeing Susan leaving, but we have to continue and we have to continue living our lives. Don't be shy to do the golf and be sure that you go to the HOA and say, okay, be careful how you place the pesticide. Be sure this, the same with the dogs. It's just we have to